Hello, everybody. My name is Paul Formaker. I'm the Program Director at the Myotonic Dystrophy Foundation. Thank you for joining us for our webinar today. I'm happy to introduce Ms. Deborah Dennis. She's a Program Analyst in the Social Security Administration Office of Disability Policy. She is responsible for coordinating Compassionate Allowances list expansion efforts within Social Security. Prior to coming to SSA, Deborah worked as a professional medical relations officer and as a disability examiner in a state disability determination service. In addition to her knowledge of the disability adjudication process, Deborah has extensive experience working with regional healthcare organizations that specialize in teaching, research, rehabilitation, and providing services to persons with disabilities and disabling conditions. So thank you very much, Deborah, for joining us today.
Oh, great. Thank you, Paul. Hello, everybody. This is just a great experience for all of us involved. And thank you for the invitation to speak with you about Social Security's Compassionate Allowances Initiative. During the presentation, you'll hear me referring to Compassionate Allowances either as Compassionate Allowances or CAL. Today, what I would like to do is to provide you with an overview of Social Security's two disability programs and to speak with you in depth about the CAL initiative. And I'll be more than happy to take questions after the presentation. Social Security has two disability programs. The Social Security Disability Insurance, which is financed through the Social Security taxes paid by workers, employers, on through your FICA taxes. So when you look at your FICA, when you look at your W-2s, you'll see something that says FICA. That is what the money is going into Social Security. The characteristics of the SSDI program is that they're paid for by Social Security taxes. They're based on your earnings performed under Social Security, and that there's a mandatory 5-month waiting period after disability insurance benefits are awarded. And monthly benefits are based on your average lifetime earnings. After you've received Social Security disability benefits, you're eligible for Medicare after 2 years of receiving benefits. On the other hand, Supplemental Security Income is a needs-based program. You're almost immediately eligible for Medicaid, so there's no waiting period. This program is available to adults with limited income and financial resources, those who are age 65 and older, and disabled individuals or individuals who are blind. It is also available to disabled children from birth to age 18. For more information about the SSI program for children, please go to www.ssa.gov/benefits-SSI. It's important to remember, again, because SSI is a needs-based program, there is no waiting period. You may also be able to receive SSI in addition to monthly Social Security disability benefits if you have a low income and few resources. Social Security's definition of disability is very strict. We consider you disabled under Social Security rules if you cannot do the work that you did before. We decide that you cannot adjust to other work because of your medical condition, and your disability has lasted or is expected to last for at least 1 year or result in death. It's important to remember that Social Security does not pay partial or short-term disability benefits. You must have a severe impairment, and you must not be unable to perform your past relevant work or any other work that exists in the national economy. That means the national economy, not just where you live, but in the national economy. Our program rules that assumes that working families have access to other resources to provide support during periods of short-term disability, That's why we don't offer this short-term disability. And those disability short-term things are available through your employer, workers' compensation, insurance, savings, and investments. In the case of children under the age of 18 applying for disabilities, we consider a child disabled under Social Security rules if the child has or suffers from a medically determinable physical or mental impairment that results in marked and severe functional limitations. If the child's impairments does not meet or equal one of our listings, we will determine if the child's impairments functionally equals the listings. This means that we evaluate the effects of the impairment of the child's ability to function at home, school, or in the community. I'd like to add, you will hear me referencing listings. And what listings are, they are Social Security's rules for evaluating disability. And at the end of the presentation, I will provide you with our web address where you can look and view the rules that Social Security uses for identifying disability. Due to recent economic recession, the number of disability claims has increased. People who are working while disabled are filing for benefits because they have lost their sources of income. In addition, our workloads have skyrocketed as members of the baby boomer generation have entered their peak years of disability risk. Our fast-track disability processes allow us to expedite disability claims for our sickest claimants despite the pressures on our field offices and our state disability determination services from the increase in applications. The Compassionate Allowances Initiative began in 2008. We are very happy to announce that we have approved over 500,000 claims through the CAL process. That means that we have expedited the processing of claims for over 500,000 people. SSA has several processes for expediting disability claims. Some of them were established many years ago when our disability case processing was manual. Now that our disability process is electronic, we've created other processes that help us provide faster services to our claimants. I will briefly describe our expedited processes. Presumptive disability. An individual that meets special impairment categories, such as an individual with amyotrophic lateral sclerosis, or ALS, or also known as Lou Gehrig's disease, may receive up to 6 months of payment prior to the formal medical determination. I'd like to add that presumptive disability only applies to people who are applying for supplemental security income. Terminal illness individuals have terminal illnesses receive quicker processing as well. When an individual applying for terminal illnesses disability benefits, we must have evidence of a terminal illness that has come from statements from the person's claiming disability, the person's friend, family member, doctor, or medical resource. Or there may be an allocation where the individual is registered in a Medicare designated hospice or is receiving hospice care. Our Wounded Warrior process is an automated system that we began in 2005. Wounded Warrior service members who have become ill, injured, or sick while in active duty status receive faster disability claims processing. And I'd like to add that the Wounded Warrior expedited process applies to individuals who were in the service from 2001 to present. Our quick disability determination process also is an expedited procedure where we use computer analytics. We have a computer that uses a predictive model that analyzes specific elements of data within the electronic disability claim. We're looking for cases where there's a high potential that the claimant is disabled or whether there's evidence that the person has a severe disability that we can obtain quickly and easily. In 2008, we began the Compassionate Allowances Initiative. And I know many of you are probably thinking, wait a minute, how is compassionate allowances different from quick disability determination? Compassionate allowances began in 2008 when we focused primarily on rare diseases and rare conditions. What the Compassionate Allowances Initiative does is we expedite the processing of claims where people's conditions are so severe that their condition invariably meets Social Security's disability standards. That's what the medical listings are. The automated process is based on the name of the condition only. That's why it's very important when a little later in the discussion, we'll talk about the impairment summary names and alternate names, because those are the names or the ways that we will be identifying these cases. The application process. I'd like to spend some time on the application process, because we realize that individuals are applying for Social Security disability. We know that they have experienced either as caregivers of individuals with disabilities or they are themselves living with a disabling condition. And they, at that point, when you're applying, have reached many financial hardships. And we know that the process, because in some cases the fear of the unknown, and people sometimes hesitate to apply for disability benefits. So I'd like to just walk through what is that process for applying for disability. And there's several ways that you can apply. You can apply online or through making an appointment with our Social Security office in your area. We're very proud that we have been able to move from a paper-intensive process to fully electronic process for disability. With our electronic or online application, you can start and stop before you submit. For example, many times, because the application has many questions that you may have to go look through your paperwork to find, you can save information and come back. So that's a very nice feature. Most of the forms that we have can be completed online, depending on the type of benefit that the person is applying for. While at this time, SSI application, that's your supplemental security income, needs to be completed in person. I know you're saying, oh my goodness, what do I need to have when I'm applying? And this is where it's beneficial to gather all of your information ahead of time before you sit down and actually apply. We'll ask you about your condition. And what we mean by condition is, if you have it, have the name of the condition. What is it that you actually have? For example, in the way that you know that, for example, we would like the name as opposed to symptoms. We have seen in some applications, for example, I have back pain. Yes, that's a symptom. But there's generally, if you have a symptom of back pain, there is a diagnosis that goes with us. So that's why we would ask you to provide us with the name of your condition. And all of them, we know that some people have multiple conditions. So we have space on the application process where you can write as many as you can or need to. We'd like to know about the treatment that you've received for your condition. And that's the treatment that you've received from a medical source. We'd like for you to have, if you have a physical impairment, to provide us with the names of the physicians or other medical sources who are treating you for the physical condition. Or if you have an impairment that is related to a mental condition, we'd like to know who is treating you for your mental condition. In the case of children, in the application process, besides the medical sources, we will ask you if the child is in school to provide the name of the school that the individual is going to, or if there's another healthcare source that provides services to the child. We like to know about your medications, your educational background, your past work history, and we will ask you to get permission to request your medical records. I like to spend some time on medical records too because individuals say, oh, I've been to many different healthcare providers, I've been to many people that have my records, and I can't afford to get copies of your records. There's no worries because once you give us permission, we will contact and pay for the medical records to be sent to us. We have established relationships with many healthcare providers where we receive those records electronically. So it takes seconds for us to get medical records in some cases. We do realize that there are some healthcare organizations that are still use paper records. What we do in those cases, we provide the healthcare provider with a fax number where they can fax directly into our computer systems. And so we would also receive those records in a matter of minutes as well. The information that you provide to us regarding your names of your conditions, the treatments, your medications, help us to make a decision on your claim. So what happens next? Once the applications are electronically sent to our state disability determination services, the disability determination service will review your records. I'd like to add that we have state disability determination services in each state and in 4 provinces. The DDSs are fully funded by the federal government. They determine the eligibility for our 2 disability programs. And upon receipt from the disability determination case, the disability examiner, along with our medical doctors, will review your records. In some cases, individuals it's been a long while since they've gone to the doctor, but they still have a disabling condition. If the information that you provide us is not sufficient for us to make a decision, we will send you for a medical consultation. It's called a consultative examination. And what we have is we have in each state doctors who assist SSA in providing us with information through an examination on your condition. Once all of the information is gathered, the DDS makes the initial determination or decision on the case. There's a five-step process for helping us make a decision on your case. First, we'd like to know, are you earning substantial gainful activity? That means we will be looking to find out whether or not your earnings for the month have exceeded $1,180 per month. If you're earning more than $1,180 a month, we will find that you are not disabled. That does not include like sick leave or vacation leave, it is actual work time. We'll also determine whether or not your condition is severe and that it interferes with your work-related activities. Here's that magic word again. Does your impairment meet or equal a medical listing? What medical listings are is a fancy word that we use for our rules. And at the end, again, I'll explain what medical listings are, or list of impairments, and where you can see them to see which rules we are using to evaluate your case. Excuse me. We will look at your past relevant work to see if your impairment prevents you from doing any work that you've done within the last 15 years. If it does not, we will find that you're not disabled. If we find that you can do work that you used to do from 15 years ago, we have to go to the next step, and that is whether or not you can do any other type of work. So the five-step decision-making process, you'll also hear us refer to the 5 steps for making a determination as a sequential evaluation process. We will decide in the 5-step process, are you earning over substantial gainful activity, that's over $1,180 a month? Do you have a severe impairment? We will find that out through your medical records. Then we would check to see if your impairment meets or equals a medical listing. That means we will be looking to see if your disabling condition meets our medical listings or the rules that we use for establishing disability. Then we would go to see if you could perform any work that you've done in the past, and that's over the past 15 years. Then we will check to see if you could perform any other type of work in the national economy. That means anywhere, not just in your city or your state, but anywhere in the national economy. I know what many of you are interested in is how do we evaluate disability for children? We use a 3-step as opposed to a 5-step process when evaluating children. In step 1, we will determine if the child is working and that the work that the child is doing is substantial gainful activity, that's over $1,180. And we will determine whether or not the child is disabled regardless of the medical condition. In step 2, if the child does not have a medically determinable impairment, or the impairment is a slight abnormality or a combination of slight abnormalities that cause no more than minimal functional limitations, we will find that the child does not have a severe impairment and will not be found disabled. At step 3, if the impairment causes marked or severe functional limitations, and if it meets a medical severity of a set of criteria of the medical listings, we will determine whether or not that impairment functionally equals a medical listing. We consider a child disabled under Social Security rules if the child has a medically determinable physical or mental impairment that results in marked and severe functional limitation. If the child's impairment does not meet or equal one of our listings, we will determine if the child's impairment functionally equals the listings. This means that we will evaluate the effects of the impairment of the child's ability to function at home, at school, and in the community. Compassionate allowances is one of the newest processes that we use to expedite the most severely disabled individuals, and that started in 2008. I must stress that compassionate allowances is not a separate program from our 2 other disability programs, meaning Social Security Disability Insurance or Supplemental Security Disability Insurance. CAL expedites the disability decision for these 2 programs. Compassionate allowances does not change the amount of the benefit to which the person is entitled. It does not change access to Medicare or Medicaid, and it does not waive mandatory waiting periods. We began the compassionate allowances process with outreach hearings back in 2007. And we started with 25 rare conditions or cancers. We've since expanded the program to where we're now at 228 conditions as of September of 2017. In 2017, we added three conditions, and one of the conditions was uh, congenital myotonic dystrophy. We do plan to add more compassionate allowances conditions, and we are in the process now in trying to identify candidate conditions. How do we add these CAL conditions? We get this question all the time because it's important. Because what compassionate allowances does, it expedites the processing of disability claims. And that's important to many individuals who, as I mentioned before, might be experiencing financial hardships, either as the individual with the disabling condition or as the caregiver of the individual who is living with the disabling condition. CAL conditions are added from information that we receive primarily from public outreach hearings that we've had in the past. We have had 7 outreach um, hearings in the past, beginning in 2008 through the last one that we had, 2007, through the last hearing that we had in 2011. Because of the way that the technology has advanced, we no longer perform hearings as we did in the past. We primarily use our disability forums, disability topics, or webinars as a means to perform our outreach to the community. We also work very extensively with the National Institutes of Health. The National Institutes of Health and the research that they conduct helped us to formulate or to identify compassionate allowance conditions. Advocacy organizations, that means you, are very important to our work in advancing the Compassionate Allowances program. Your work is important to us because you are working on a daily basis with either as caregivers or individuals who are receiving services from your organizations, or your contact with physicians and claimants on a daily basis. We receive numerous recommendations from advocacy groups for CAL conditions. There is no magic formula for selecting a condition. We make recommendations to include conditions for CAL after we've reviewed medical conditions or information that we've received from the public, our analysis, and recommendations from our own staff. When we're selecting conditions for compassionate allowance, we also have to make sure that the condition meets our definition of disability. That means, does it meet our medical listings or our medical rules? Because compassionate allowances is an electronic process, we have to make sure that our computers are able to completely identify CAL conditions based on the claimant's allegations. So that means is whether or not we have enough information to provide our computers with to accurately select a compassionate allowance condition. Remember we talked about the disability process on how we do CAL cases? This is what we do when we get a case or a name of a condition. We have an individual who applies for disability, and that person is applying with a condition that's on the CAL list. It's important to note again that compassionate allowances is not a separate program. What we're doing is looking through our computers, so looking through allegations to see if we can fast track those cases. We have computers that's a search and find. That's why when individuals are applying for disabilities benefits, that they provide us with accurate information regarding the name of the condition. The compassionate allowances computers are only looking for the names. They're looking at the names of the condition, We're also looking for if alternative names. So that's very important. So when you see your application, it'll ask you for your allegation. It's very important that you input accurate information. A lot of people ask us, well, what if I spell the name of my condition wrong? We have in our computer systems here, we've programmed, we have a very sophisticated process where our computers are able to recognize common misspellings for each cow condition alternative name. But it would help if you provide us with accurate information as to exactly what the name of your condition is. Once the case is identified for fast tracking process, and this takes seconds. Say, for example, you are sitting in the office with your Social Security office, and the individual who's working on your case, they are typing in information that you give them regarding the name of your condition. Once they have typed that information, they send that information electronically to the State Disability Determination Services. Within a matter of seconds, our adjudicative staff or our disability determination services are notified. They get an indicator that tells us, like, hey, pay attention to this case because it's a severe case and it meets one of the 228 conditions that we have on the CAL list. Once the adjudicator accepts the case and sees that this case warrants fast track processing, we've again expedited the process by providing our adjudicators with desk guides. Those desk guides provide them with shortcuts that helps them to fine-tune the manner in which the case is processed. Okay, and this you already know about your condition, congenital myotonic dystrophy. You know, I want to talk about too, yes, we identified along with the work that your foundation did in working with us and our medical and healthcare providers, we were able to determine that the congenital form of congenital myotonic dystrophy warranted fast track action. But we've also heard from individuals, and we know that there are many different forms of myotonic dystrophy. They'll say, hey, what about my case? And I'd like to talk a little bit about that. Say, for example, a person comes in to file for disability, and they may not have a disease that's on the Compassionate Allowances list. Their case will still be seen. I always provide the analogy of going to the emergency room. When you go to the emergency room at a hospital, each person who enters that emergency room will be seen initially by someone at the front desk, and they will be typing in information about what's wrong, what is the nature of the disability, and they may have you sit down. You'll notice while you're sitting there that some people might be moving before you do. Those are your severe cases. But if you sit in that emergency room long enough, you'll notice that each person who goes through that emergency room will get services. It's the same with a person who has a compassionate allowances condition. We have identified a set of 228 conditions that meet our definition of disability, and we've determined are very severe cases. But there might be other cases that may not rise to the level of a compassionate allowance. Those individuals will be seen, their cases will be seen by a disability adjudicator and a SSA medical doctor. So those cases will be seen. The only difference between a compassionate allowances condition or case or another case is that those cases are expedited. All cases that we received will be seen. It's just a timing issue, and it's a case management issue for our adjudicators because they know that if the case is a compassionate allowance condition, they will expedite all the things that they'll do. They may call you to get additional information. They'll make sure that all of your letters that we need to get information for your doctors are sent out right away. They may, in some cases, if all we need, for example, is a record, they may even call the facility to get that information so that we can make that determination fast. Most of the individuals who have applied for Social Security disability who have congenital myotonic dystrophy have been allowed. So that's good news. We know that your organizations have provided with us a good recommendation for a case that meets our definition of compassionate allowance. The impairment summary. I mentioned a few minutes ago that once a case is transferred to our disability determination services, our adjudicators, the adjudicators who work on cases in a disability determination services are individuals who have been trained now that's, I would like first to say that state disability determination adjudicators go through extensive training on evaluating medical conditions. They are trained on understanding the Social Security disability process, and they're provided with updated training on, for example, if there's changes in the rules that we use for adjudicating cases. So we're working with individuals who are highly trained. In the case of adjudicators, and you'll hear me either say disability examiners or disability adjudicators. So when you talk with individuals who are doing your cases, you may hear those two terms. Because a lot of the conditions that we have on compassionate allowances are rare, what we've done is we've provided our adjudicators with a desk guide, which is a snippet that provides them with a brief description of the disabling condition. And then you'll notice that we also provide the adjudicators with the information that we will need to adjudicate that case according to our medical listing. At the bottom, you'll see the little letters that begin with HTTPS. Each compassionate allowances condition that we have is available to the public for review. And at the end of the discussion, again, I'll explain how you can see it. Compassionate allowances is one of the forward-facing programs that SSA has. Our website is up for both individuals and groups to review. The impairment summaries that you see here for each compassionate allowances condition is available for public review. And when you go down, right now we only have half of the impairment summary, but for each compassionate allowances condition, we have the medical listing or the rule that we use. So you can see it for yourself. A lot of people say, well, my condition is severe. How are you evaluating my case? And we'll say, well, go to the medical listing, and that describes the rules. Each compassionate allowance condition has the rule associated with that condition that provides our medical examiners, our disability examiners, and our healthcare, our doctors, with the rules to adjudicate the case. I know this is hard on the eyes, but what this is there's a complete list of compassionate allowances conditions. Our website has all of them a lot bigger so that you can see them, but you can also click on those conditions to get the impairment summaries for the CAL conditions. And there's 228. We last added 3 in September of 2017, and we do plan on adding more in the future. Next slide, please. Those are the 3 that talk about the conditions. So we go to CAL facts. Okay. The easiest things, I know this has been a lot of information within this hour period, but the easiest way to remember everything is that compassionate allowances is not a separate program from SSA's 2 disability programs. There's no additional money or under SSA's SSDI and SSI programs. And SSA, that means us, will expedite your applications for those with compassionate allowance conditions. What I've provided you with is there's websites or web links for you to go to find out about Social Security disability application process and information about the Social Security Compassionate Allowance condition or program. And I've also provided you on the next slide with information about publications that you can go to find out more about the disability application process, compassionate allowances, and also publications that will explain that are printable or that you can get from the Social Security office about applying for benefits if you're more of the type of person who would prefer to have a paper copy as opposed to an electronic copy. Wow. So I guess right now, at this point, we'd like to open it up for questions.
Thank you very much, Deborah. I appreciate you going through this so thoroughly for us. I do have a few of those links that we talked about yesterday on here for people to look at as well. But there are a couple different questions I've been receiving through the chat here. And a few of them have to do with unemployment and disability. One person currently is receiving unemployment and wants to know if that prohibits them from getting disability benefits. And another person has not filed for disability because they thought it would impact their unemployment status. And I was wondering if you knew anything about that and could possibly shore that up for us.
Okay. If you have questions about how, like, unemployment benefits affects disability, or sick leave, or if there was a payout from your employer, it's best to call the Social Security office directly. And I believe we have a telephone number listed in our sets of resources. Let's see if I have it right here at hand. But it's a 1-877 number. I think we provided it. Give me a second. But that is the best way to find out. And the reason why I'm not speaking about it is because we've developed the policy and the rules for compassionate allowances. So any information or additional information that you need regarding money or about how to apply, it's best to go through the actual 1-877 number through the Social Security office.
Got it. So it's not a blanket rule is what you're saying, is that every single person has a different situation and they should check specifically with the office, correct?
Yes, that is correct. They need to check directly with the Social Security office in their area or through the 877 number. I think like 3 more slides backwards, I think it has a telephone number in there. Okay, it's not there. All righty. That's your best bet.
Okay.
And when you call the Social Security information line, it's available from 7 a.m. to 7 p.m. And staff are there to answer questions about Social Security disability.
Okay. So those were the main questions. I got to answer a few of the other ones that I thought I was qualified for. Do similar rules apply for eligibility for Social Security retirement benefits dependent on someone retiring who is disabled prior to age 22? Does that make sense to you?
Yes. That, again, would be best be answered by calling the Social Security office, that 1-877 number.
Okay, hold on a second. Social. See if I can find that number.
I'm looking through my things as well. Yes, I have it.
You have it? That'd be great.
1-800-772-1213.
Okay. Because once again, that's specifically a personal question and not a general rule, correct?
That is Correct. Oh, and I did promise to provide you on how you would find out about how we evaluate disability and the rules that we use.
Yes.
So on the screen we have www.ssa.gov. You would then get to our Social Security website. You would click on disability, and then you have the ability in the browser, and you would type in Blue Book. That's our short name for it, or Evaluating Disability under Social Security. And that would provide you with the whole rules that we use for evaluating disability.
Blue Book, definitely.
Yes, that's the easiest way to remember. Blue Book.
Okay. Any other questions anyone wants to type in here? Be happy to answer them or refer them on. While you're doing that, just want to let everybody know this video and the PowerPoint will be posted on our website, www.myotonic.org. You can find it underneath the Digital Academy. We'll make sure that it's very available for everyone to find on the front homepage for at least a couple of weeks so they can click to it when they need to. And also don't hesitate to contact us here at the foundation if you have questions. I help people apply all the time. My direct line is 415-872-7924.
Excuse me, Paul, may I add one more thing?
Please.
If you or any of your members would like to recommend a compassionate allowance condition, you would type in www.ssa.gov/compassionate allowances. That will take you to our homepage. And on that homepage, we have the links where you can recommend a condition for conclusion for compassionate allowances. But also on that link is we link you directly to applying for Social Security disability. So you can it's in two places. You can get it through our Compassionate Allowances website, or you can get it from the www.ssa.gov. Since many of your members have children who have disabling conditions, and the publication link that I provided you regarding Social Security benefits for children is a very, very helpful resource because it talks about what are the qualifications, what is the impact of family income, and what is it, and what benefits is the child eligible for. So that if you don't get any other publication, that publication will be a good one to have in your personal libraries.
Okay. Got it. One more question for you, and this is probably something that's specific as well. But if a person was denied prior to the compassionate allowance being added to the list, congenital myotonic dystrophy, would their chances be different if they reapplied now?
Okay, that is a good question. The compassionate allowances cases are identified electronically. So if a person is making a new application, a new disability claim, not a reconsideration, but a new claim, the adjudicators do, if it's not picked up electronically, our adjudicators can, what we do is manually add it. For example, if your case was denied, someone else is looking at that case again, maybe it's in the reconsideration or if it's in a hearing. We hear this all the time. And at the time, maybe you didn't have a compassionate allowances condition, our staff can manually add it. For example, we also get many times individual may not realize that they have a condition or there's new evidence of a condition. So we built that feature into compassionate allowances where we can manually, staff who have the correct clearance can add that case to compassionate allowances.
Got it. Any other questions here? Okay. Okay. Once again, if you have other questions or other things come up, don't hesitate to call me here. If we didn't answer something that you're looking for here today, please give me a call here at the foundation, 415-872-7924. Just the last question that came in. So someone asked if this applies to DM2. So generally no, because DM2 doesn't have a congenital form, as we know of right now. If you can say that you've had symptoms since birth, then we could discuss that. But right now, congenital myotonic dystrophy is generally a type 1 disease.
Can
So
I
make
add
sure
some
that we have that out
information?
there. Please.
Let me add some information, Paul. Remember where
Yes.
I gave the analogy about going to the emergency room and you
Yes.
have to sit there? Okay. And this is a great time to talk about it. Right now, we have congenital myotonic dystrophy on our list. So we know those individuals who apply with us, their cases are going to be automatically identified. However, if someone has a condition or different form of myotonic dystrophy, their cases will be seen again. Will be seen. They're not just going to be hanging out there in limbo. And with the cases that are not on compassionate allowances, we look at them individually. Okay, so the case will
Right.
be seen. It will be seen. It's just the only difference is that case will not be fast tracked or expedited. That's the only
Right.
difference.
Anything general about the Compassionate Allowance Program that anyone wants to ask? Okay, well, with that, Deborah, I want to say thank you very much for joining us today. And no, last second, fast track does not mean approval. Generally, it should, but they just get it to the front of the line quicker. They still have to show the evidence and show that it's there. Correct,
Yes.
Deborah? They still have to show it.
Yes, you
So,
have to have the evidence.
right, the evidence in the medical records from your doctors are very important. Make sure that they know which doctors to go to. There's not a lot of change on the patient side of what you have to do here. They're just going to do it more on the SSA side to be able to analyze your application. So if you need anything or you have any questions, once again, you can call me here. I'm happy to answer. If it's something I can't, I'll refer it to Deborah and she'll be able to figure it out for me. But once again, thank you so much, Deborah, for coming on. We really appreciate you taking the time here for us at the Myotonic Dystrophy Foundation, and we'll get back in touch with you soon if anything else changes.
All right, thank you.
Take care. Bye-bye, everybody.
Bye.